Why are so many people leaving the NHS? It is a complex organisation, so it is a complex answer, but the data shows us some of the various reasons. Let's start with work-life balance. This chart shows people who've left the service on top of what we'd expect if resignation rates had stayed the same. And you can see that work-life balance in red is well over and above the other reasons, relocation or health, for example, with that increase costing the NHS 10,000 staff last year. Staff across the NHS now 3 times more likely to quit due to work-life balance than they were a decade ago. And we can see that strain in another set of figures, people taking time off work due to stress, anxiety or depression. That is a 56% increase since 2015, nearly 500,000 days off for mental health, or 1 in every 80 working days. So a worse work-life balance, worse mental health problems, and on top of that, less pay. For example, adjusting for inflation over the last 10 years, a nursing assistant's pay has been pretty flat. But compare that with a switchboard operator or a warehouse worker, their pay going up, you can see why some NHS workers might consider moving jobs. And Brexit is another reason the NHS has been losing staff. A recent study by the Nuffield Trust found the number of European health workers moving to the UK has declined steeply since the 2016 referendum. Now, for some areas like nursing, it's managed to fill those gaps from outside the EU. But it is a different story for some medical specialisms like surgeons. In the years since Brexit, the number of doctors recruited from every sector here, the EU and elsewhere is less than it was before, but much less from that blue of the European Union. The UK is training more new recruits at home, though. It has been for a while. For the last 2 decades, the UK has produced more medical graduates than the average OECD country. Yet it still lags behind in terms of practicing doctors per population. And that's mainly because of lack of training posts after graduation. And leave you with this, which shows the growing problem. We hear about more doctors adding, the workforce expanding, and it has by 179,000 in the last 4 years. But the growing demands that there is this gap, and that gap is why we have a crisis, because vacancies are rising, not falling.